One of the most common CT exams is the abdomen and pelvis. Yet most of us do not know that much about it. Hi, I'm Nicola, and I'm a CT tech. I'm here to talk to you a little about the scan most frequently done, the abdomen pelvis CT. I find that most of my patients really have no knowledge of what the scan is, why it's being done, and what they can expect. The only thing they do know is that their doctor ordered it. My thoughts are this: the more you know and understand about your healthcare, the better healthcare you're going to receive. So let's start out by talking about what CT scanning really is. Computed tomography, or CT scanning, also known as CAT scanning, is a medical test done in radiology that physicians use as a diagnostic tool. It uses special X-ray equipment along with sophisticated computers to produce hundreds to thousands of pictures of the internal body. Once the CT images are produced, they are sent to a computer screen where they then can be examined or even printed. CT scans are more detailed than regular X-rays, which help confirm multiple abnormalities that may be lurking. The abdomen pelvis scan helps diagnose the cause of abdominal or pelvic pain and diseases of the internal organs, bowel, and colon. Infections, inflammatory processes, cancers, stones, as well as diseases of the vessels can all be detected using CT imaging. These include, but are not limited to, appendicitis, inflammatory bowel disease, pancreatic cancer, lymphoma, kidney stones, and abdominal aortic aneurysms. CT scanning can be very helpful in many different circumstances. In trauma situations, it can quickly confirm injuries to the liver, spleen, kidneys, or other internal organs. Guided biopsies and other procedures such as abscess drainages use CT to ensure accurate instrument placement. Computed tomography also helps surgeons plan for and evaluate the results of surgery. And radiation therapy uses CT to stage and plan a specific area needing radiation treatments. Now that we know a little about what CAT scan is and what it's used for, let's talk about what you can do to get ready for your exam. Comfortable clothes and preferably no metal should be worn. Zippers, snaps, and metal buttons can all cause distortion to your images. You may even be asked to wear a patient gown. All jewelry and hair accessories that is in the field of the exam must be removed as well. You should not eat or drink at least 3 hours prior to exam in the instance a contrast material is to be used. Informing your doctor is key before any procedure. Your doctor should know any illnesses, allergies, and or medications. You need to tell your physician and your CT tech if you have heart or kidney disease, diabetes, as well as allergies to the contrast material or dye. These conditions can cause you to have a serious reaction. Women, remember, you must tell the CT tech if there is any chance you may be pregnant. Okay, now that you are dressed appropriately and informed your doctor of any implications that may impede or alter your exam, let's get you prepared for what you're going to see in the exam room. The CT scanner reminds me a lot of a large square donut with a round hole in the middle. Inside this machine sits the X-ray tube and electronic X-ray detectors. They actually rotate around you at high speeds in what's called a gantry, while you lie on a long, narrow table that slides in and out of the hole. The technologist works in a separate room where the computer console is located. They monitor examination through speakers and a large window. You're probably thinking, how is this donut going to scan me? First, for an abdomen pelvis exam, you will lie flat on your back with your feet towards the machine. Now, contrast material can be admitted 3 ways: intravenously, orally, and or rectally. I'm going to give you a little hint. If you're not able to keep the oral contrast down due to vomiting or nausea, the greater chance you have to be given rectal contrast. And I don't know about you, but that would definitely encourage me to keep as much of the oral contrast down as possible. More often than not, oral and IV contrast will be used for the abdomen pelvis CT. The oral contrast is usually taken about 2 hours prior to your exam. Our oral contrast is called Omnipeg. Along with this bottle, you're usually given written instructions, which tells you to mix it with about 1 liter of a beverage of your choice, except for dairy or carbonated beverages. Once on the table, the technologist will place you into the donut approximately to your chest. The machine may give you instructions during the exam like hold your breath, so don't let it startle you. When the scanning starts, it will actually pull you back out of the hole. You will then be placed back in the hole. The tech will come in and inject the IV contrast, and about 30 or so seconds later, the final scan will start. The entire examination from placing the IV to the final scan usually takes about 15 to 20 minutes. Always plan for about an hour though, especially in a hospital setting. CT is always in high demand with the inpatient wards and the ER, so emergent add-ons happen quite frequently, and sometimes back up the regularly scheduled patients. Okay, now you know what's going to happen, but how are you going to feel during and after your procedure? Are you going to be in pain or able to go for a bike ride as soon as you leave? CT exams are usually the most favorite exams of the hospital. They're quick, fast, and easy. The contrast shows where you may feel your discomfort. Oral contrast may not be the greatest tasting, but definitely bearable. Rectal contrast is by far the worst. It gives you severe abdominal pressure, but once released, the feeling should fade rather quickly. IV contrast should give you a warm, flush feeling throughout your body. You may even feel like you're peeing your pants, but you're not. It just gets real warm real fast down there. And all the warmth should be gone within a few minutes. You may get a metallic taste in your mouth, possibly a little stinging at the injection site. If the stinging is real bad or persistent, or if you get any pain, you need to let the tech know immediately. It could mean the IV is not working correctly or that you're having an adverse reaction. You may return to work or other normal activities after your CT. Now, saying that you're able to return to normal activities doesn't necessarily mean you can go for a bike ride as soon as you're done. Remember, CT is not a treatment, but a tool used to diagnose so that your doctor can treat you appropriately. In other words, if you weren't physically capable to ride a bike before your CT, you won't be able to after either. We went over what CT scanning is, why it's used, how you should prepare, the equipment, how the scan is performed, and the effects it will have on you. I hope you understand CAT scan a little better, especially the abdomen pelvis CT. Remember, be proactive with your healthcare. Ask questions and talk to your doctor about anything you think may be altering your health. The more your physician knows, the better he can diagnose, and resulting in the most effective treatment. Peace of mind from understanding what's going on with your body and how it will be treated goes a long way. You are sure to be much happier, and you will see better results.